Medicines and home haemodialysis. People with kidney disease usually need to take medicines every day. Some people need to take a lot of medicines for their kidney disease, as well as for other health problems like high blood pressure, diabetes, heart conditions, asthma, or for their mental well-being. Taking a lot of different medicines can be very difficult, and even though medicines are there to help you, they can sometimes make you feel unwell. We know that people having longer and more frequent haemodialysis at home usually feel better, live longer, and have a better quality of life, compared to people dialysing in the dialysis unit. People on home haemodialysis can also relax their fluid and diet restrictions and don't need to take as many medicines. Patients tell us that this is one of the main benefits of home haemodialysis. Blood pressure is better controlled, so blood pressure medicines can sometimes be stopped. Longer and more frequent haemodialysis is better at cleaning the blood and preventing the buildup of minerals and waste products like potassium and phosphate. Better control of potassium levels in the blood eases the strain on the heart and blood vessels. Medicines used to lower phosphate levels in the blood, sometimes called phosphate binders, can usually stop. This is good news because people with kidney failure often need to take a lot of these tablets every day. Before starting haemodialysis at home, you or your dialysis partner, if you have one, will be trained how to give medicines and dialysis fluids through the dialysis machine yourself. Injections to prevent blood clots while the blood flows through the dialysis machine are injected into the dialysis machine at home. Injections to treat anemia, a low number of red blood cells, sometimes called EPO injections, are either injected into the dialysis machine or under the skin with a short needle. Most injections given through the dialysis machine can safely be given at home. Sometimes people with kidney disease need iron infusions to treat anemia. Iron infusions can cause a severe reaction in some people. This reaction is not common, but iron infusions should be given in the hospital or dialysis unit by a nurse, just in case. The kidney pharmacy team and the storekeepers are part of the home haemodialysis team. They will make sure that you have all the medicines and supplies you need. We try to be as flexible as possible with deliveries, for example, delivering fewer supplies more often if storage space is a problem in your home. If you have any questions about the information in this video, or if you would like to learn more, speak to your renal team or visit our website.